Getting experience, spending time with patients, around patients, silly things just like learning how to talk to people on a day-to-day basis, learning how to talk to patients, learning how to see how they're doing today, and learning how to share their horrible moments but also their great moments. The things that you want to be able to do as you move forward in your medical career, you can see it from a much closer angle. Hi everyone, my name's Ed G. I'm a first year medical student here at Warwick University. Well, I've just finished my first year and I'm heading to second year now. And I've just come to give a talk. Ollie's asked me to come in today. First got into university doing psychology. I studied psychology up at Durham University. It was a really interesting degree and I really enjoyed it at the time. I had no designs on doing medicine. I had no concept that would be what I ended up doing. So did psychology for 3 years. Enjoyed it, but I found I enjoyed mostly the aspects of it that tended towards the biological, the more kind of grounded in what is anatomy, but I didn't really realise was at the time. I just thought of it as being biological. So I ended up doing a master's down in Bristol studying neuropsychology, which was great, and actually at the time didn't realise how good it would be. Really actually ended up pushing me more towards doing medicine. It was more clinically based than my undergraduate degree was, and it was lectured by a wide range of individuals involved in neurology. And actually, the lectures I enjoyed the most were the ones that were pushing me more towards doing sort of more the ones given by doctors or neurophysiologists or psychiatrists. So at that time, I just by chance came across the fact that graduate entry medicine was even a thing. At that point, I'd never even considered it.
So that's interesting then, you haven't always wanted to be a doctor?
No idea whatsoever when I went to university that medicine would be what I ended up doing. I had vague designs on doing something something clinical. I suppose I thought I'd end up being a clinical psychologist. I'd really enjoyed psychology at A-level and figured it was as good as anything to do at university. I knew I wanted to go to university, but wasn't necessarily 100% sold on anything. But medicine was the last thing I considered. Didn't even just didn't think of it. I didn't have the grades, even if I'd wanted to do it then, but it didn't even cross my mind.
How old are you now, Ed, and how old will you be when that changes to Dr. Ed?
So I'm 26 years old now. I was 25 when I started my first year here at Warwick, so I'll be 30 by the time I graduate.
So what did you do in that span of time then between finishing your master's degree and coming to medical school?
So when I finished my master's down in Bristol, I ended up staying down in Bristol. And at that point, I still wasn't convinced I wanted to be going and doing medicine. I still had designs on being a clinical psychologist. I still had thoughts that I was unsure. I saw myself at a sort of a fork in the road, and I had to decide which path I wanted to take. So my way of figuring that decision out was to go work in a psychiatric hospital. So I applied across loads of different hospitals, but I applied to go work originally just as a bank support worker down in a psychiatric hospital near Bristol. I went into that job having the idea that I would see both clinical psychology and medicine or psychiatry at work and what each job looked like day to day, and I'd have a chance to talk to both professionals or both branches, and I could get a really good idea of what both had to offer. And I did that. Well, I worked on the bank for a year, and then I worked permanently on a particular ward for about a year as well. And fairly early on in those 2 years, I decided that medicine was the path I wanted to go down. And that's when I started looking into the route and what I would have to do in order to get to where I am now.
What's been your favourite part of the Warwick course in first year?
So it's been very different actually, the Warwick course, perhaps than I expected, but it's obviously very different from my first or second degree. I've really enjoyed the anatomy teaching. I suspected I'd enjoy anatomy before I came here, but the quality of it and the quantity of it as well has been really extraordinarily good. It's very unusual for any medical students to get really a look at recently deceased tissue or individuals that have recently passed away that have been basically professionally dissected for our purposes. And certainly we had a revision session at the end of the year that was remarkably good. It was, I almost wish I'd known, I'd been able to have that experience again a bit later on in my career. Perhaps I would have been able, would have understood more, would have been able to take even more out of it. But as it was remarkably useful. And certainly coming from something like psychology, where you maybe have a bit of a concept of physiology and maybe have a bit of a concept of how cells work and things like that, anatomy is really one of those areas that is quite alien. We don't learn, again, speaking for myself, I didn't know a lot of anatomy, bits of neuroanatomy, but that was about it. I really didn't know very much. So I was reliant on the course to be very good in providing materials for me to learn, and in that respect it's excelled itself. So, and even when the live and fresh tissue isn't available, the plastinate specimens are always fantastic. They really do help demonstrate some of the concepts you've been learning about that can be very difficult to visualize when presented on a screen or in a textbook. Seeing it, being able to turn the specimen around, being able to ask questions of an expert effectively in anatomy, inordinately useful in helping develop your knowledge and contextualize what you're actually learning about day to day or going through the week on a Friday at the end of the week, really helping just dial in everything that you've come across.
What's the biggest key difference you've noticed between studying for your psychology degree and now studying medicine?
Certainly this year, in the first year, there is far less time to get your head around some of the concepts that you've been taught. I found in my psychology degree, I can't speak for any other university, but certainly at Durham, the contact time was very minimal. I think I had 12 hours was about average between over the 3 years. It gave you a lot of time to go over lectures, perhaps get your head around. Sometimes the concepts in them were quite tricky. Whereas with medicine, the pace is far, far quicker. You've got far more contact hours, you've got far less free time. So adapting to that and trying to use my free time or the spare time I had to go over bits that we'd learned that week, I had to use that far more wisely. The material wasn't necessarily any harder. In fact, in many ways I'd say it was easier, but there was just so much of it, which was so different to psychology, that required a bit of a culture change for me.
It sounds like you've had a really good amount of clinical experience then, so based on your understanding and what you've seen, what's the difference between a psychologist in that clinical field and a medical practitioner?
My frustration with what the day-to-day job of a clinical neuropsychologist looked like, having done my master's degree, was that it involved delivering a lot of pen and paper tests. It involved a lot of statistical analysis and it didn't involve a lot of patient work. It didn't seem to, and I've only seen a thin sample of clinical neuropsychologists, but the work that I saw them doing was intellectually interesting to me, but it didn't really have the right blend, I suppose, of intellectual curiosity and patient fronting time. Certainly when I was working on the wards and I saw what both had to offer, I suppose medicine offered a far broader path. You know, once you have managed to get on and do a medical degree, the road really opens up. There's so many different ways you can go, and there's so many different areas of medicine you can explore. That really appealed to me, whereas I feel even doing a clinical psychology degree does put you in a particular position. You're ending up going and doing one fairly specific thing, and there are a few avenues within that, but you're more tightly constricted in terms of the angles you can go down.
So over the course of this first year, we've been exposed to, various kinds of medicine. Have you got any thoughts on your future or a specialty?
So I always tell people, and it is a bit of a cop-out answer really, but I always tell people that I don't really want to dial myself into a specialty before I've seen some of the realities of what different specialties offer on a day-to-day basis. You have to have an overall affinity for it. You have to be excited by what you're going into. But I think, for example, surgery, I think that the idea of surgery is quite exciting to a lot of people, but the realities of it, a lot of the challenges that it poses, and a lot of the really sacrifices you're going to have to make in order to get to the point of being a surgeon. And even then, when you are a surgeon, there's a lot of sacrifice involved. And I think until I've really seen the day-to-day of some of the options that I'm weighing up, it's difficult to make a decision. But I will answer that isn't a cop-out way. I do like the idea of surgery. Having spoken about how much I've enjoyed anatomy, my brain works in a very sort of machine-based way, I like to say, but I like knowing how things work and how mechanically things can function and how those can go wrong. And I think that appeals very well to surgery, where you need to have a kind of overarching concept of how a certain area works, but also how pathology in that area can affect the wider system as a whole.
So an orthopod there?
Potentially an orthopod, but I don't know. I'd be really interested to see a few of the branches of surgery in action. Weirdly, vascular surgery seems quite interesting. I can see this video coming back to haunt me in 20 years' time, so I'll hold off on giving a definitive answer. And I haven't given up on the idea of doing psychiatry. I mean, it's an unusual branch of medicine. It really is unlike any other branch of medicine. It's tough, I think. It is challenging, and there's risks involved that aren't very obvious. You know, if you make a mistake in surgery, it's usually apparent immediately. Whereas if you make a slightly risky choice in psychiatry, you may not see the results of that for weeks potentially. It's a different type of challenge. And again, I'm looking forward actually in the years coming now to spending a bit of time on psychiatric wards, but from a medical perspective rather than from a nursing perspective, and getting a bit more of an idea of how we can diagnose and treat some psychiatric conditions.
I think most of us probably agree now that being able to have some downtime and relax and not study medicine for a while is really important. So what sorts of things do you get up to?
Sure. So it's really drilled into us as medical students and indeed as medical professionals that you do need to have a life outside of medicine. And I couldn't agree more. This year has been really tough. It's been really enjoyable and really rewarding, but it has been very intensive. Finding time every week, trying to carve out some time and spend some time doing things that I enjoy that aren't anything to do with medicine has been really crucial. I've been very fortunate to have people that I've gone and seen on the weekends, so I've spent a lot of time with my parents down in Hampshire, with my girlfriend, with whoever, friends and family generally. And it's sometimes really nice to remove yourself from the bubble of medicine that kind of surrounds Warwick Medical School, and indeed every medical school. And it can get a bit tiresome when people keep telling you that that's what you have to do. But I couldn't agree more that actually finding yourself an activity you can do that is nothing to do with medicine whatsoever, that you enjoy and you take pleasure in, is really crucial in surviving certainly the first year of medicine, but arguably your entire medical career.
If there was one key takeaway message that you would give to people in your position coming from that psychology background to medicine, what would you say?
So the one piece of advice I'd probably give to aspiring medics that are doing psychology at the moment, although many of you will probably be impatient, many of you probably want to be here as soon as possible, I couldn't recommend more strongly going and getting some practical work experience working in a clinical environment. As much as I enjoyed my psychology degree, and as much as hopefully it has stood me in good stead throughout my life, in terms of relevance to this degree, the 2 years I spent working on wards have been far more relevant than the 4 years I spent learning in classrooms about the brain and psychology and neuropsychology. I would really strongly recommend, it doesn't have to be 2 years like I did, it doesn't even have to be a year, it could just be a summer, but getting experience, spending time with patients, around patients, learning silly things, just like learning how to talk to people on a day-to-day basis, learning how to talk to patients, learning how to see how they're doing today, and learning how to share their horrible moments, but also their great moments, the things that really the things that you want to be able to do as you move forward in your medical career. You can see it from a much closer angle from somewhere like a support worker or a healthcare assistant role.
Have you found either your psychology degree or your master's useful at all when it's come to making the change to medicine?
Sort of. If I'm completely honest, it was less use to me than perhaps other degrees have been to certain people. So doing something like a biomedical degree, for example, obviously you touch on ground that you will touch on in medicine, but I think a lot can be made of that, and really coming to medicine is a challenge for anyone. Certainly at Warwick, we've got people that have come from all walks of life, and probably psychology has helped me more than it's helped someone that's maybe done sort of French and business, for example. That's a very, very different kettle of fish. So has it helped me? Yes, it's given me some ideas of concepts, but it's probably helped me more actually with my interactions with patients and understanding there are a lot more elements, and sometimes people's medical concerns aren't top of their list. They're more worried about psychological concerns or some of their social concerns. You know, they're not really fussed as long as they can get to their daughter's 5th birthday party or something like that. And that can seem perhaps alien if you come from a solely biological perspective, if you're only looking through a biological lens. But having an extra lens in my arsenal, having another kind of filter through which I can judge, or not even judge, but view behaviour and understand people's behaviour and beliefs is really useful. I wouldn't understate how useful that has been. But probably the most useful thing for me in terms of a day-to-day has been working in a clinical context. As I say, I couldn't recommend that more, even if it's just for 6 weeks or something, you know, even if it's just spending a bit of time doing something. I'd really recommend that. That's been really useful to me in my preclinical years, so I can only imagine it's going to be even more useful next year and the years after, when we spend a lot more time patient-facing. So that's really it. That's sort of the end of the interview. I have given Ollie my email address, and I'm happy for anyone that's studying psychology at the moment or is even thinking of studying psychology and going on to do medicine. Feel free to get in contact if you've got any specific questions. I'm more than happy to get back to you. I'll do my best to do it when I can. If you want to ask now in this summer period, I'll be much better at replying than I will be when we're deep in our second year. But I just want to wish everyone good luck. It is stressful. I remember applying myself, and you don't know how it's going to be, and it's all very confusing. But Ollie is a fantastic resource, and if you've followed along with his materials, you'll be in a really good place. You'll know a lot more than I did before I applied. But I just wanted to make it clear that it's very doable, having done psychology. And Warwick, I'm sure it's the same at other universities, but certainly I have felt no less prepared having done psychology than I would have done having done another degree. And I don't regret my choice for a moment. At no point in the year, even though it's been really challenging at times, I've never regretted my decision, and I'm very happy I made the decision I did, and I'm really glad to be here. So good luck to anyone. If you've got any questions or you're thinking to apply to Warwick, do let us know. And if you are applying to Warwick, I look forward to seeing you in the future. I vaguely was aware that I wanted to be a clinician when I was older, but I'd really enjoyed doing psychology. Sorry, got attacked by a fly.